Hello.
Yes, bro.
Yes.
Yes, yeah. Sorry, I got some technical data problem. Thank you very much. Sorry for bit delay. I just finished my meeting also, and you also just finished your lecture, I guess. Okay, a very good morning. Welcome back to our BPM 3416 lecture 3. Yeah? So, as earlier we have covered the oral cavity as well as the general introduction of the GIT. Now we move further down. And now we are passing our neck region, our thoracic cavity, and we move into the stomachs. So I mentioned earlier, if we regard of stomach, in animals with different species, there are different structure. For monogastric animal, they have only one simple stomach, while in polygastric animals, they have four stomach, which is rumen, reticulum, omasum, and abomasum. And when you look in terms of chicken, for example, bird, they have proventriculus and gizzard. So they are what I call it the most important component of the stomach in terms of the gross or anatomical structure. So with this regard, we cover something quite, particularly on the four stomachs on our list lecture 3. I mentioned here four stomach belong to ruminants particularly. And what is so important with regard of four stomachs condition that usually occur is a tympany oblate, meaning that is over distension of the rumen as a result of detention of maybe very viscous gas or as a result of just a normal gas. So that is we classify as primary or secondary tympany. Like the other organ also, inflammation is important. And the stomach one is important, inflammation of stomach, particularly referring to the fourth stomach of ruminants, we call it as ruminitis. And many times, ruminitis can be associated with grain overload. Yeah, that's why we have ruminitis and acidosis caused by grain overload. Why grain overload is important? Partly because in this case, they occur as a result of changes on diet, especially when we change the diet immediately. Very good example is that normally when you keep by the goat or cattle, in normal situation, animal undergo grazing in the field. But when you want to start your feedlotting, if you do immediate changes with regard of the feed given to the animals, you might have problem with this grain overload, meaning that animal might have very severe or bloated, then can lead to death to the animals. And the fourth one, maybe this common, usually probably if it is cattle grazing in the construction area where they have condition called traumatic reticular peritonitis. Mean a sub-object penetrated the reticulum wall, then into the peritoneal cavities or the abdominal cavities, sometimes go to diaphragm, and even go to the thoracic cavity, involving the pleura as well as the heart. So I think traumatic reticular peritonitis. We used to have quite a number of cases. I mean, when we have animals, for example, at one time, UPM have their own farm with number of animals. Mardi also have quite a number of animals in their farm. But now those number of animals is reducing because of the development of the area, where now you have all the building maps and many other things. So the number of animals is much less. We compare of those days. Similarly also even around our area, even the Putrajaya now used to be is a farm. Yeah? So we have quite a number of cases, particularly with regard of cattle or goat, but no more. Now even Putrajaya all is a building, no more animal grazing, no more farms, very less you do have also. Then when you go to the single stomachs or monogastric animals or the abomasum, where abomasum almost play the same role as the stomach. The inflammation is called it as gastritis or abomasitis. Remember on your first on the second lecture, inflammation of stomach is gastritis. It's not stomatitis. So stomatitis is inflammation of the oral cavity. And we have abomasitis. In addition to gastric ulcer quite common in animal as well as in human, partly due to changes in the environment of the stomach, particularly the acidity, because stomach play an important role in excretion of hydrochloric acid. So it is imbalance between mucus secreting cell that produce mucus with the peptide cell which is producing what I call it hydrochloric acid. Excessive hydrochloric acid could lead to auto-necrosis, meaning cause damage and necrosis of the mucosa of the stomach. And usually they can cause erosion leading to ulceration if the damage is deep enough involving the basement membrane. The other system, of course, security disturbances also is important in the stomach. This is epithelial lining of the what I call it oral cavity, pharyngeal, esophagus, and anal canals. But when we move further down, from the stratified squamous epithelium, we comprise of 5 stratum types, basic, spinosum, granulosum, lucidum, and corneum. Now the epithelial lining has changed into more of a granular structure. So this very beautiful epithelial lining of the stomachs, actually see from the red. And the role of stomach and the abomasum is more towards of secretion. And you look carefully there, in terms of those glandular structure, actually the stomach comprised of the gastric pit, ischemium. Then you can see that the epithelial lining, particularly the most important one, is surface mucus secreting cell. So this is what we call it, the mucus secreting cell that produces mucus. Then we have what we call it a parietal cell, body producing of hydrochloric acid. So there must be a balance between the parietal cell secretion and mucus secreting secretion to avoid of any what we call it auto digestion or autolysis or not damages of the epithelial lining of the stomach. So this needs to be balanced because the role of this stomach is mentioned is more on the secretion. And this is how you look when you look. I mean, this is very beautiful. Of course, it's selected. I think this photo is taken from my PhD thesis. Yeah, sorry, just to share with you. So nice that one. Long time ago. That was sometime. When was it? Probably that was taken sometime in 1989. You know, because I completed in 1990. In 1989. Those photos. Okay. So this is the stomach of the abomasum secretion. You can see that those are epithelium, and you can see also the relation of those are the blood vessel and basement membrane, where this blood supply into the epithelial lining of the stomach. If you remember again, the epithelial lining of GIT mucosa, you comprise of the epithelial lining, and the epithelial lining keep on changing from one part to the others. And then we follow the submucosa. Then they have also all the inflammatory cell and circular as well as longitudinal muscular layer. Okay. I mentioned earlier, one other common condition that we observe in for stomach is tympany or bloat. This is a result of over-detention of rumen with either frothy. Normally when frothy, it is primary bloat, or from free-form gases, which is secondary. But please remember, over-detention of the rumen also can be result of postmortem change. When animal die, then they decompose, then the abdomen will be over-distended. So that one is not a bloat. Overdistension also probably could result of pregnancy. Okay, and that pregnancy is not a blood. Overretention also could be accumulation of fluid in the abdominal cavity, and that is not a tympani or blood. But the most challenges to differentiate between tympani and postmortem change is that is over the distension is due to the postmortem change. Yeah, so that will be challenge for you to make sure that the overretention of the rumen is actually to the condition or is a lesion, but not a postmortem change. I will discuss later when we want to differentiate between tympani or blood and with a postmortem change. So it can be a primary or it can be secondary. And again, the importance of primary and secondary that we recognize is with regard of our approach to the treatment. Yeah, meaning that if it is primary, you have different type of approach. When it's secondary, you might have a different type of approach to ensure that our treatment or our approach of solving the problem is successful. That is only important to understand it is primary or secondary. Similarly, also, when you talk about stomatitis, you have primary and secondary. The primary one is direct there, while the secondary one, what you call it, as a result of systemic infection. So in this case, the primary one will discuss later, and what is the secondary. Okay. Any questions so far? Tak ada ya? Ada soalan? Tak dengar?
No, Prof.
No, Prof.
Okay, thank you. I just make sure that we are I don't have I worry that I'm talking alone. Sorry. And this is what we call it as a primary tympani. Usually when you get primary, they are acute onset. And this is especially due to the excessive production of foamy viscous rumen content. Meaning that when you have foamy viscous rumen content, foamy means they are very difficult to get erupted or ruptured. Yeah? When you got like that balloon, but it's difficult to rupture, so as a result of that, they keep on accumulating. And now they are not being excreted outside the stomach, whether it is through the mouth or to the what you call it, anus or rectum. So they are not able to be removed from there. So when the gas is caught in viscous gas, foamy form, keep on accumulating and cannot be excreted. That's why they become a problem. Mean that the rumen become what I call distended. And usually this one is due to the high grain in diet and many causes of, I mentioned earlier, grain of loaded, or maybe as well as legume also. So in terms of therapy, normally what we do, even we can just put a trocar, means just poke the rumen, gas will be out, then the animal will relieve from the side effect or the feedback of over retention of the rumen. Yeah? Because when the animal have over retention of the rumen, they will cause increase in the pressure in the abdominal cavity, which they push also those pressure into the thoracic cavity, leading to what you call it a poor venous return, particularly those blood from the caudal part of the body might not able go into the what you call it return back to the heart. And animal also might have difficulty to breathe because of the pressure that is developed in the thorax in the abdominal cavity. That's partly they can cause death. That's why tympani in acute form, if not being treated immediately, can cause death to the animal. And this can occur whether in ruminants and sometimes also less common in monogastric animal. Because in monogastric animal, the condition is slightly different. Okay. And what we expect to see when we have a primary tympani. I mentioned earlier, this criteria is important because when animal die of in normal condition also or due other infectious diseases, with time, the abdomen also will be distended. But those detention, we call it as a post-mortem change. Of course, the first thing when they have primary tympany, we expect to see they will distend the abdomen. And interestingly, you might expect to see also blood exudate from the orifice, meaning that there will be blood ooze out, particularly on the orifice, like oral cavity, nostril, or maybe also in the anus. And usually they are dark and clot poorly because they compress a lot of carbon dioxide. That is to the anoxia. So there is an indication, but don't forget those type of blood, okay, because normally when congestion is very severe, blood can escape to the blood vessel and then can lead to ooze of blood outside the blood vessel. Yeah? So that's why we can see sometimes those very severe congestion might lead to hemorrhage. But when you look at that condition, also be careful. Sometimes some diseases, particularly the severe one, for example, like anthrax, might show the same appearance with regard of those blood clot or sometimes hemorrhages in those of the orifice, like nostril, oral cavity, or even in the what you call it genital and the anus. Yeah. So that's one of the criteria. In addition to distended abdomen. Similarly, also you might see an area of subcutaneous hemorrhage, particularly in the area of neck and head. Why this happens? Because when there is an abdominal overdistension, there will poor venous return. Not only from the anterior part of the body, but also from the posterior part of the body. And that lead to accumulation of blood in the area of neck and head. I mentioned earlier, when the severe congestion, blood might ooze out from the blood vessel, and what you see there is more of the hemorrhage. So this is what I call it the third criteria. Similarly, also, if you are lucky enough, you might see what we call it blood line. Yeah? It's blood line. It's an area of congestion and often hemorrhage in the cranial to the thoracic inlet. So if you look at the thoracic inlet there, so we have caudal. Cranial means is the posterior, yeah? Posterior part. There will be a formation of this blood line. But unfortunately, this blood line sometimes disappear with time. So if you're lucky enough, you can see that as a criteria. And finally, if it is frothy, like in cases of primary tympany, in this case, you can see that the rumen content is frothy. But unfortunately, this frothy rumen content might disappear within 10 to 12 hours after death. So these some of the criteria in terms of gross lesion when you observe what you call it in animal with case of primary tympany. So the important to understand in terms of the lesion is that for you to differentiate that this is primary tympany when the presence of frothy rumen content. This is a blood or tympany when the presence of blood line, hemorrhage, or maybe blood exudate. And this is not, for example, is as a result of postmortem change, or even sometimes when you look animals struck by thunderstorm. Okay, there will many bird animals will die off, and you can see the abdomen also distended, and that is not due to what you call it tympany, and that one is due to, of course, death and discompose of the animals, leading to detention of the abdominal cavity. Any question? Yeah. So this is an example, and this example actually is a growth overload, a real case. Maybe the photo not very clear, but this is a herd of goats. I think quite a number when you have this case. And this on the postmortem table, you can see the abdomen is standard, the head is over there. And this case actually is bloated due to the grain overload, where actually this goat was kept for feedlotting with immediate change of feed from the grass into the concentrate. So quite big number of animals in the herd die off due to what we call it grain overload, and they have very severe distension of the abdomen. And what we expect in this case, if you get a grain overload, but please remember this foamy material might escape within 10 to 12 hours. You expect to see foamy viscous rumen content in the rumen. Then this is what we call as a blood line. You look carefully here. This is a point there. This area is pale. Okay, this is a lung, this heart. Somewhere here is a thoracic inlet. Yeah, the thoracic inlet there. And this line is a right where pale and very severe congestion. And this is a blood line. An indication of blood can be a primary blood or can be also a secondary blood. They'll produce a blood line. But not all the time you expect to see this blood line depending on when you do your postmortem. In cases of secondary tympani or secondary blood, there may be acute onset when the incident of blood is acute, but the process to have a secondary tympani actually is a chronic process, meaning they take some time. Not like what I call it primary tympani, which maybe take so much shorter time, whether acute or subacute. But the onset is same; they are very immediate, and usually they are due to the physical or functional defect in the eructation of gas produced by normal rumen flora fermentation. So what happens is that it's a normal process where there will be a fermentation by the normal rumen flora in the rumen, and the gas will accumulate. But in normal condition, this gas will be eructed. But unfortunately, when the GIT was blocked or obstructed, so this gas failed to be eructed and start to accumulate in the rumen. The changes in this case, they are similar to those of primary blood, except there's no frothy rumen content, but they are present of foreign materials such as hair, maybe wool, or maybe plant fibers. This can cause block to the what you call it eructation of the normal gas produced in the rumen content. Apart from this, there's possibility also sometimes in cases of neoplasia at the area where can block the eructation of the gas might lead to what you call it secondary blood or secondary tympani. So what's important here? Probably regard or immediate treatment may be about the same. You can use trocar and remove all the gas. But that is not good enough because to solve the problem, you need to remove those of the foreign material. Yeah, whether it is hair, whether it is wool in the lumen, or maybe it is neoplasia in the wall of the GIT. You need to do that. Similarly, what you call it sometimes in small ruminants, what you call it monogastric animals, they are as a result of displacement of the spleen leading to torsion of the stomach. They might have the same thing also. So the approach of treatment is different when you compare with the primary tympani. So this I mentioned to you. The important thing is that to understand what is primary and secondary, partly we as a veterinarian, our approach to effective therapy. Yeah, that's very important. And for make a diagnosis, you have to understand what is the difference of this primary and the secondary. So this is an example where the rumen is impacted by plastic sac. Okay, this usually is not environmentally friendly, where the plastic sac has not been digested in the GIT, so they can cause accumulated there. Sometimes also when ruminant or cattle graze under the rubber tree, they might have a rubber latex. They might consume rubber milks, and will be what I call it clot here, then cause obstruction also. But one good nice story actually what happened is that a case of this tympani as resultant for impacted rumen content. Actually, the animal or the goat, actually the case, is die off due to consuming of sarung. You know sarung? Kain, yeah? Kain plekat ke kain. Yeah. What happened was, you see in the villages, normally they will dry their sarung outside the house and hang it under hot sun. And then, unfortunately, those are free grazing goat will take it, and whether that sarung might drop from the what you call it, the place, then they consume it, and they cause what you call it blockage in the rumen. There is a real story. It happened. One case of goat died off to those infection, and inside there, what present is a woman sarung. Okay. And in the what you call it in the monogastric animals, this one example is gastric torsion. They can cause bloated also. This is a German Shepherd. You can carefully then you can see very enlarged spleen. Real case we have, and then you can see those of the what you call it or the stomach is twisted. Me here long time ago. We still see you still old camera there, and you can see those of the what you call it the spleen is very enlarged. So this enlargement of spleen leading to rupture of the ligament, and a result that leading to twisted of the stomachs, and that twisted of stomach leading to very severe blood. And what is the treatment normally we use if we enough time to help? Of course, we need to do remove the gas from the distended stomachs. Okay, be careful, but sometimes there might be some leakages leading to infection of the peritoneal cavity. But we can cover that with antibiotics because it's an immediate. You have to remove the gas, and that might be follow up. It's really due to the enlargement of spleen. We can do of removal of the spleen, splenectomy. Remove the spleen. Okay, animal can survive without the spleen. Remove the spleen and put back everything there. I think I experienced that. I was a clinician before. I was working in small animal for about 1.5 years before a pathologist. So we remove back, and then what you call it, the animal will survive. But the issue is that we'll take an immediate action, and you are there enough to do an emergency. But remember that one case is due to the babesiosis, and they're really high or significantly enlargement of the spleen. So they can be a cause of infection, but it can be also cause of neoplasia. Yeah, when they are neoplasia of the spleen, they are extremely enlarged, and that lead to damages of the ligament, leading to displacement of spleen and torsion of the stomach. Any question? Ada soalan?
Prof, I have a question.
Yeah.
Just wondering, like, can secondary and primary tympani happen simultaneously?
Can secondary possible, but it's not likely. I mean, you have to identify one, meaning that if you have both evidence, yeah, probably that can kill the animal probably is a primary tympani first. Okay, because you remember that the frothy material is because if the secondary mean the foreign material might take longer occurrence if compared with frothy material. It can occur together. I mean, the evidence can occur together, meaning that you can see a frothy materials. You can see also foreign objects. But probably when you look there, if both evidence present, most likely the cause of death is the frothy material first. Yeah, most likely. Okay, because I think because the what I call it, the secondary one is a normal gas until it's very severe. They really completely block the irritation. Then only they can cause what you call it, those very severe blood and death. Okay, it can occur, but maybe our diagnosis cause of death is probably due to the primary tympani rather than to secondary tympani. Okay, may I answer you?
Yes, thank you so much, Prof.
Welcome. So I mentioned earlier how you to differentiate, because very important, yeah. This is important also with stomach, especially when you conduct postmortem in rabbit. Yeah? Many times when you conduct in rabbit, you must see that when you open, the stomach ruptured. Yeah? Stomach ruptured, really. This is quite common when you do, believe me, when you conduct rabbit carefully, there's many instances when you do conduct necropsy, you find that the stomach ruptured. But you have to be careful whether that rupture actually is due to postmortem change or is it due to the deletion. Because many times, those rupture stomach actually is due to the postmortem change. Why they occur? When there is stomach content and animal might die off quite some time, and then we got traveling and bringing animal to necropsy room and so on so for handling, the wall of the stomach or the rabbit is quite soft, and normally they just get ruptured and what we call it, feed material ooze out from the stomach. So with regard of that, with regard of anything, yeah, when you talk of postmortem change and also lesion, the most important thing is that if it is a postmortem change, there is no tissue response to injury. And what I mean by tissue response to injury? Those of 10 type of lesion. Meaning that if it is what you call it, postmortem change, as a result of stomach rupture, for example, mentioned just now, there might not be a hemorrhage. There might not be inflammation, maybe, kalau type same time. There might not be what you call it, exudate. So there's nothing. There's no tissue response to injury. So there's no tissue injury, so there are postmortem change. That's a concept. Yeah, you be careful when you examine, because you have to really establish this, because otherwise it's very embarrassing. Okay, you say it's a lesion, but actually it's postmortem change. Okay, so in addition to postmortem change, there are also agonal change. Agonal change meaning that changes that occur during process of death. The same thing also very important. And particularly in this case, when you have a blood clot in trachea, for example, and this happen maybe whether in animals like goat or even ruminants or even chicken, when the animal was slaughtered. Yeah? Meaning that during process of death, those blood that ooze out from the neck region might be aspirated and present into the tracheal lumen. So that is agonal change. Agonal change meaning that changes that occur during process of death, and they are not hemorrhage. Okay? So you have to establish, make sure whether there is only a postmortem change or agonal change. And the concept is that there is no tissue response to injury, because if there's a blood clotted there in the rumen, in this agonal change, you expect to see that the epithelial lining of the trachea is normal, no congestion, no hemorrhage, and anything. So it's agonal change. Similarly, also in this case, when you talk about postmortem distension or postmortem changes compared with tympani, normally in cases of postmortem, what I call it, changes, there is no tissue response to injury, absence of extra ruminal lesion condition as well. For example, just now we expect to see what I call it, blood line. Okay, blood line might be easy to detect. There's no blood line. Then you look at the lumen, no fatty materials, no foreign objects. Then you look at the orifice, no congestion. You look at the neck, no subcutaneous hemorrhage or congestion. So that one actually is a postmortem change. And there are also absence of lesion in the rumen. So please make sure these very simple things, but sometimes it's very embarrassing. Yeah, that we have to establish. Because I already mentioned that when we are in the postmortem room, when you conduct a necropsy, your mind based on three things. One is agonal change, any changes that occur during process of death. Second, post-mortem change, any changes that occur after death. And what we are looking for diagnosis actually is a lesion. Okay. And we talk about lesion, we talk about those 10 type of lesion or 10 type of tissue response to injury. We must establish that. Meaning that you look at thing changes, you straight away, is it lesion? Is it postmortem change? Is it agonal change? You have to establish that. Then you yes, this is lesion because they are reddening, because there are some exudate, they are fibrin, they are hemorrhage. So all those involve inflammation, involve secretory disturbances. So it's a lesion. Can you clear? This is a very important concept that you have to really, because we don't want that very simple one, but we tend to make a mistake. Any question? Tadi ya, thank you. And the cause of death, this is very important. When we talk about cause of death, cause of death is very important. When you remember with regard of definition of disease, disease is adverse interaction between agent, host, and environment, leading to formation of lesion and clinical sign. Okay, so that is a disease. You have a interaction, you got agent, you got lesion, and the clinical sign. And the worst clinical sign, of course, is death. So when you talk about cause of death, actually you will reverse the process of pathogenesis or definition of disease just now. Because when you talk about pathogenesis, pathogenesis will start from the agent go into the host, causing a lesion. Lesion cause very severe, leading to cellular and functional dysfunction, and those cellular functional dysfunction leading to dysfunction of the organ, particularly involving the vital organ. So the vital organs such as respiratory, circulatory, and central nervous system failure. So when you look carefully here in the cause of death in cases of blood, so the cause of death particularly due to the what you call it, the vital organ failure. Vital organ failure. Why does vital organ failure? Because they are present or lesion. Why those lesion is occur? Partly because they are agent that can cause those lesion. Okay, agent cause those lesion. It's reverse of the pathogenesis. So for example, in cases of blood, what is the cause of death? What is the cause of failure? The cause of failure particularly is due to the failure of what I call it respiratory, circulatory, as well as central nervous system. Those three vital organs very important. Their failure. What we mean by the failure? Because particularly usually there as a result of ischemic necrosis. You know ischemic necrosis, ischemia in the central nervous system. Central nervous system. Why they are ischemia? Because there is a low blood flow, even nutrient in those of the cellular nervous system, partly because they are low cardiac output. Okay, low cardiac output. Why low cardiac output? The low cardiac output is because they are low, what I call is a venous return. Because in this case, there will be low venous return, partly because the organ is undergo very severe congestion, as well as the high intra-abdominal pressure and over detention of the abdomen. Okay, so that's why they are low, what you call it, venous return. And those venous return actually as a result of over detention of the abdomen, where those detention because of accumulation of either frothy or normal gas as a result of legumes, if it is primary blood, or as a result of probably those are the foreign material, it is what you call it secondary tamponade. Can you follow me? Can you follow me when we talk about cause of death?
Yes, Prof. Yes, Prof.
Okay. And that's why this is very important for us as a pathologist. I mean that if you reverse the pathogenesis, of course, you start from the agent, over distension, intra-abdominal pressure, severe congestion, low venous return, low cardiac output, ischemic necrosis of the vital organ, and failure of the respiratory or secretory disturbances. So that is a cause of death. That's why I mentioned earlier. The concept of definition of disease is so important. The understanding of pathogenesis is so important. Similarly, the understanding make accurate diagnosis is so important. And in this case, of course, the definition of disease, the knowledge on the pathogenesis, we apply with regard of cause of death to the animals. Of course, when you talk to your client, probably you just say that the cause of death is due to the blood. That's good enough. Otherwise, very complicated. They will not gonna understand, you know. Okay, they will confused. You have the animal have blood. You finish to your client. But in the report, scientifically, there is actually the flow. What is the cause of death? And that's very important for you to justify, because the whole step will help you justify. For example, why there is severe congestion? Because there are internal pressure, overdistension, blood return flow are low. And then when you have severe congestion, what happens? Or there will be low venous return to the heart, low venous return, low cardiac output. So that only pathologists can understand, and your client might not be able to understand. But this again is concept of death to me as a pathologist. Yeah. But when you explain to your client, maybe you just say that the cause of death is due to the blood. If they ask you why blood cause death, then you can explain to them slightly more details. Okay, yeah? Can follow me? Yeah? This is a very important concept for me that can apply to any condition or situation when you talk about cause of death. Then the second one is rheumatitis, inflammation of rumen. Usually they involved with mycotic, more of fungus, yeah, and usually occur with the inflammation. Usually might go into the serosa, even they go to basal layer and very deep, and that can cause hemorrhage, and even sometimes perforation of the rumen, where actually those of rumen content will flow out into the abdominal cavity, leading to severe peritonitis. Again, that time we have to discuss how this severe peritonitis can kill the animals. In simple way, severe peritonitis might lead to what we call it septicemia. Septicemia lead to dilatation of blood vessels, low of venous return, low of cardiac output, ischemic necrosis of vital organ, particularly the brain, and that lead to the vital organ failure. So there is a cause of death. You have to understand that. And the second one is urea. Urea also can cause partly rheumatitis, very common, particularly when the animal grazing, sometime after fertilizer given in the field, and the distribution is not equal, and then the animals might tend to have more intakes of this urea. But sometimes also, the animal break through into the what you call it store that keep the vegetable, they keep the fertilizer, and that lead to what you call it rheumatitis. Usually, diagnosis is that, of course, when you open, there will be immunosmell in the rumen, and there will be what you call elevated of the pH. So the complication of this, I mentioned earlier, is peritonitis. And this peritonitis can lead to death, as what I discussed previously. Okay. This is an example of rheumatitis, normally due to the fungus, and this is from the serosa surface. So how deep is it? You get reddening, got hemorrhage. Of course, they are multifocal. They occur in the what I call it in the rumen. And you conduct what I call it you look at the rumen in the mucosa surface. This is how they look like. And usually the epithelial lining of the rumen are difficult to detach. In normal condition, when animal die off, one of the way that you conduct necropsy, when you open the rumen apart to see the content and so on, you try to peel the mucosa of the rumen, yeah? And usually they are easy to take it out in normal situation if the animal is normal. But in case of rheumatitis, there will be fibrosis and attachment of this rumen mucosa in the wall of the rumen. Very difficult to remove. An indication of what we call it mycotic rumenitis. Okay, can I sample and submit to laboratory for further isolation and identification of the agent. Another important part is acidosis, usually due to gain overload. I mentioned earlier, sometimes in terms of diagnosis, may be difficult at postmortem. It is a primary tympani. The pH of the rumen is low, like example less than 5. And you might expect to see in terms of grossly, as previously described, but histologically, you might see marked cytoplasmic vacuolation of the epithelial cell, leading to vesiculation, marked neutrophil reaction in the mucosa, submucosa, and focal area of ulceration may be present or might not be present. So when you have ulceration, this is an important thing in terms of grain overload. The complication, apart from over detention of the rumen itself, we might cause acute death to the animal. But in long run also, they might have complicated with fungal infection and also might have encephalopathy due to the timing deficiency. So in short term, with their over detention, they can lead immediate death. But in long term, there might be also ulceration and perforation of the rumen, leading to peritonitis and can kill the animal as well. Okay. The last one, traumatic reticular peritonitis. This mode of perforation of a stomach by foreign body always is a penetration of reticular wall with sharp foreign body, resulting complete or incomplete perforation. Very common, sometime I mentioned earlier, is animals that roaming in the construction area, like cattle. Sometimes you see that, and they might, what we call it, consume or takes nails, very big nails. And during the process of contraction, during digestion, those nails poke the ruminant wall. And that can even go to the, what we call it, peritoneal area, move into the diaphragm and into the heart. It can happen also from the oil pan leaf. You know, oil pan leaf used to be fed in ruminants by chopping. They cut those leaves into pieces. But please remember, those the old one, they have needles, you know, farm needles. And that needle also can lead to this traumatic reticular peritonitis. I have a case on that. I have both cases. I've seen both cases of the nails as well as those of the palm oil, what you call needles, because they are very sharp and they can poke. And that can lead to death to the animal because they lead to suppurative or gangrenous inflammation developed in the rumen wall. And even they can cause very severe diffuse peritonitis, pericarditis, pneumonia, and pleuritis. If it is due to the foreign object like nails, when it's a metal, usually what people do in terms of prevention, they fed the animals or ruminants with a magnetic bar, in the magnetic bar. So they give in the magnetic bar so that when the nail is there, those magnetic bar will attract the nails. And because they are metal, and because they have been attracted this magnetic bar, so they reduce the risk of perforation or the risk of those sub-objects cause, what I call it, penetrated into the wall of the rumen, reticulum. Stomach education changes is quite straightforward in terms of secretory disturbances, the hyperemia, hemorrhage, and edema, but they have also gastritis and ebumyositis. And the classification of what I call it, ebumyositis can be cultural, hemorrhagic, and sometimes we have also chronic gastritis. Hyperemia is more standard condition, but example of hyperemia you can have, or even hemorrhage at a certain extent. We have caused by salmonella, hot cholera, coliform, and sometimes in chronic renal failure. In chronic renal failure, animal will have chronic gastritis, meaning that those excessive of urea in the blood circulation will lead to erosion and ulceration of the gastric mucosa. Okay. Then we have hemorrhages. Usually can be as a result of consequent of congestion, and other than that, the submucosa might undergo edema. Yeah? So this all is more tissue response injury to what I call it monogastric animals. These hemorrhages, I think that slide I showed you before. So you can see very severe hemorrhage of the abomasum. This is from deer, yeah, infected with cases of malignant catarrh fever. So they believe that this malignant catarrh fever is due to the herpes virus infection. Okay. Then we have acute catarrhal gastritis. Normally involved in acute mean catarrhal mean mucus, but sometimes might further extend into hemorrhage and erosion. And very important, those example acute catarrhal gastritis is due to the diseases related to catarrhal and stomatitis diseases. In chronic form, we get acute hemorrhagic gastritis, manifestation by hemorrhage, can be as a result of Clostridium septicum, leading to endotoxin and fetal. And in chronic gastritis, I think the cause is about the same as the acute, but they take more longer duration. This is very important in terms of hemorrhagic abomyositis. You look carefully there, very high burden of homunculus contractus. We used to have very common see these cases of homuncosis. Very high burden of homunculus contractus loaded in the abomasum, like this one, so many. But I think lately we have very less number, partly because we have less number of small ruminants, particularly like goat and sheep. And the incident is less, partly because we have less number of cases. But when you go out in the farm, I do believe that these cases of homuncosis is quite common and can be common cause of poor, poor performance of the animals, and sometimes towards the death, because the animal will be very, emaciated. Chronic gastritis, with regard to those inflammatory cells involved, particularly mononuclear cell, and you got gastric ulcer, like in this case, those ulceration can go further, leading to gastric erosion, can go further, lead to gastric ulceration, like in this case. And this is in a pig age. Okay. Time now, quite because start late just now, yeah, 1 hour, but now it's 1:02. Any question before we proceed for our this afternoon? We're going to have, hopefully we can finish within 1.5 or maybe 2 hours. Then the rest you can continue. I leave it to you for this afternoon class. So as the information I given to you, emailed to you last night, the first part, we have some guideline of the, the practicals. We got 3 practicals there, just a guideline. I'm going just to highlight some of the important things that you're going to ask, particularly when you face with a situation, yeah? When you conduct necropsy. So those type of questions must be in your mind. So I have listed with regard a question that face when you see a case. Then follow up with that, maybe you can just briefly visit all the slides that we have. You can do your homework later. Then we follow up with what we call it case study. This study also just to glance through, but I hope that you can do the case study and submit it to me. If you, then I can comment accordingly. And that will end, then follow up with necropsy. Usually the first class, I'll bring the student to the lab. Usually we have it in an anatomy lab to conduct a necropsy. But we use a chicken as example because chicken is easily available and all have chance to conduct a necropsy in chicken. That's why I choose a chicken. Otherwise, just regard a concept. We're going to have concept on necropsy for you to understand step by step how to conduct a necropsy and what you try to look for. Okay, it can be applied to other species. It's just an example. That information might be important later, but I mentioned to you, you are not going to be pathologists, or maybe only one or two to be pathologists, but try to understand the concept, the process in necropsy, so that in the future, when you are in practice, you understand what actually pathology do with your case and how they come out with a diagnosis. So you can ask, by knowing that also, you can have very good ideas and can ask the pathologist the right question based on that concept. I mean, when you ask, you're asking with something that you have the knowledge. You know what type of question you should ask. So that's the main idea. But unfortunately, the hands-on, we are not able to do that, partly because we understand that now is COVID-19. Hopefully, we can practice in the near future when condition getting better. Yeah, but maybe now you can do your high imagination of what we should do based on the photo given. Okay, any question? Last, any question? Yes, no?
No from me, Prof.
No from me, Prof.
No, yeah, okay. No, tak ada, tak apa, don't worry. So what we need to do now, we stop here. We see you again at 2 o'clock. And maybe I try to finish within 1.5 or 2 hours for the afternoon class, yeah? Boleh? Thank you.
Boleh.
Prof.
Enjoy your lunch. Enjoy your lunch. Okay?
Thank you, Prof.
Thank you, Prof.
Enjoy your lunch as well.
Thank you, Prof.
Thank you so much. Okay. Bye.